Juan, what medical conditions do you want to know that your patient has before you schedule them for a colonoscopy?
Andres, I actually asked them a couple of questions prior to scheduling the colonoscopy. The first question is if they have any medical conditions such as lung or heart disease. And this can include things like heart failure, history of a heart attack, history of strokes, especially recently. I asked them about respiratory problems like sleep apnea or COPD, which are common in our patient population. The other thing that I asked them is about certain medications like narcotics or pain medications. I asked them about antidepressants, as this might impact the way the patients are sedated. And I also like to ask them about previous surgeries, especially in women, because again, this might impact the colonoscopy.
I think you bring up very good points. Everything that you just said, it's relevant for the procedure, and that can give us actually an idea of how difficult it's going to be to sedate, to put the patient at sleep, and how technically difficult the procedure may be, particularly if they have had surgeries.
Andres, the last thing that I actually asked them is if they've had any trouble with sedation in the past, because having had trouble with sedation prior procedure might give us a clue that there can be problems in the future. So that's a question that I always ask them. Have you had any trouble with sedation?